Hello, my name is Dr. Dewan S. Raja. Today I will discuss about a neurotransmitter called dopamine. Dopamine is a catecholamine type of exciting neurotransmitter. It is produced in the neuron of the substantia nigra. Substantia nigra is a part of the midbrain. When we have a section of the midbrain, we see the dark substantia nigra, and also ventral tegmental area, that is just in front of the tectum, okay, and that is also a part of the midbrain. Ventral tegmental area, anterior part of the midbrain, and in hypothalamus. Dopamine plays an important role in motor, neuroendocrine, and cognitive function. It increases cardiac output, both the rate and force of contraction of the heart, increases renal and splanchnic blood flow. It increases the blood flow to the kidneys and as well as to the viscera of our body in the abdomen and also in our lungs. So blood flow will be increased in the viscera. Dopamine is depleted in Parkinson's disease, a disease characterized by tremor, dystonia, and slowness of movement, kyphotic appearance, little bit stooping forward. There will be drooling from the mouth. Okay, so Parkinson's disease, a neurodegenerative disease of the usually old age. Dopamine is increased in schizophrenia. Okay, there is a major psychotic disorder. In that condition, dopamine is increased. Major pathway of dopamine, okay, nigrostriatal pathway from substantia nigra. It goes to the corpus striatum, the basal ganglia area, around that. Okay, mesolimbic from the midbrain to the limbic system, like singular gyrus, fornix, mammillary body, olfactory nucleus, like that, and also to the amygdala, hippocampus, dentate gyrus. Another one is infundibulo-hypophyseal pathway from hypothalamus to the pituitary gland. So we are looking at the nigrostriatal pathway. We're looking at the mesocorticolimbic pathway. Some goes to the cerebral cortex. Some part goes to the limbic system like amygdala, to the hippocampus, to the dentate gyrus, to the singular gyrus, to the fornix. Dopamine and its receptors play a significant role in motor activity, emotion, motivation, and in reward system in the brain. There are 5 dopamine receptors. Functions of these dopamine receptors are as follows. D1 for memory, like it is associated with that of the hippocampus dentate gyrus. Attention, impulse control, regulation of renal function. Locomotion, D2 locomotion, attention, sleep, memory, and learning. D3 cognition, impulse control, attention, and sleep. D4 cognition, memory, fear, impulse control, attention, and sleep. D5, decision making, cognition, attention, renin secretion. Renin secretion from the kidney. Okay, so these are the 5 receptors. There are some functions which are overlapping. Okay, we got that. Then we have some dopamine agonist drug. We have dopamine antagonist drug. Dopamine agonist drug, like that of the bromocriptine, pargolide, rofinerol, and pramipexole, are used to treat Parkinson's disease. From dopamine, we have a precursor called levodopa. That is an ingredient of synmate, combination of levodopa and carbidopa. That is also a treatment of very popular treatment of Parkinsonism in Parkinson's disease. Dopamine agonist drug may cause hyperkinesia like chorea and dystonia as an adverse effect. A dopamine agonist drug, bromocriptine, is used to treat hyperprolactinemia and adenoma of the pituitary gland, adenoma of the anterior pituitary gland, and also to manage hyperprolactinemia. Dopamine antagonist drug, these are neuroleptic drug used in case of schizophrenia or also in a patient with altered mental status, okay, when they are in a condition of mania or some type of situation. Like neuroleptic drug like haloperidol is also used in hospice in the terminal part of the life, but mostly it is used in case of schizophrenia, like haloperidol, like that of chlorpromazine, okay, are dopamine antagonist used to treat psychotic disorders. Dopamine antagonist drug may cause hypokinesia like Parkinsonism. So, anti-Parkinson drug may lead to psychosis. Antipsychotic drug may lead to Parkinsonism or Parkinson's disease. Increased dopamine activity is associated with substance abuse like alcohol, opioid, nicotine, amphetamine, and cocaine abuse. Dopamine may be increased in a person by physical exercise and also having good diet rich in tyrosine, because tyrosine is the precursor for dopamine, and also some type of motivation like yoga may increase the healthy amount of dopamine. Also in sleep. Okay. Therapeutic uses of dopamine, a drug of choice for shock. It is given as an intravenous infusion, continuous infusion. It is a treatment for renal failure because dopamine vasodilates in kidney. So it is as a whole vasodilator. So it also dilates the renal vessel. So the blood flow to the kidney will be increased. So it is a management for renal failure. Adverse effects, as because it is a symptomatic drug, it will cause increased sympathetic stimulation like that of tachycardia. It may also increase blood pressure as well as dilatation of the pupil. Okay, there may be sweating. So these are the features of dopamine adverse effect. And that's all about the dopamine, its pharmacology, its therapeutic use, its receptors, and possible adverse effects. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.